So for the next topic, let's talk about something that not enough people anywhere in the world talk about, in my opinion, which is saline implants. And I'm not 100% happy talking about it today. I was more happy talking about it when I thought that there was the ideal implant and it was called the ideal implant. But maybe the ideal implant was sold and renamed as the Serene implant for a reason, because it's not as ideal as they made believe it was, which is the rupture rate. So there are two kinds, I'm getting ahead of myself. There are two kinds of saline-filled implants. One is, I call the traditional implant, which is basically a bag with a valve on it that gets filled with sterile salt water. Now, I just made it sound like crap, but it's not. The traditional saline implant is a fabulous device when placed behind either enough body fat or enough breast tissue. Meaning if you have a solid B cup and you want to become a C, or you have a solid inch of body fat in this area and you want an enhancement, and you're young especially, I would recommend strongly, even though they're quite imperfect, and there are two issues with saline implants, we'll get to them in a second, but I'm a big fan of them. I'm a fan of them because I love the underarm approach, and because I know that a ruptured saline implant I can still replace through your underarm. So if you're young and you're committed to not having a scar on your breast, saline makes sense. Because if you have a silicone implant that's ruptured, I can't take it out through your underarm. Now you've got to have a scar on your breast. But there's sort of a bigger thing, and it's not really a safety thing, it's a peace of mind thing, which means the traditional saline implant and the Serene implant, and what makes the Serene different, which I'm sorry I didn't tell you, it's a chamber within a chamber. So instead of a single bag, it's a bag within a bag, but these chambers, the wall of the Serene implant is it's a substantially thicker wall, and it's a digitally made wall, so it's consistent. It's not, many implants are actually dipped in silicone, and there's variability in the thickness of the wall, which may well lead to inconsistencies or increases in rupture rate. So, in summary, and sadly, we don't have a perfect implant. The Serene implant is better than the traditional in terms of having less ripples, okay? That's how it's better. So if you're really lean and you're like, I just don't want silicone, I need the peace of mind, I'm afraid about it, we'll talk about it a little bit more, but I want a saline-filled device and I'm really lean, you might end up with this Serene implant. The traditional implant has more of a ripple problem, because it's that single, fairly thin-walled bag, and if you're lean, you're just going to feel it. So if you're dedicated to that, it means either you're living with ripples, which you probably don't want to do, so you might be getting fat grafting. You know, if you have fat on you in some places of disproportion that you can remove and cover, then that's a perfect solution. There's also a product called Alloclay, which is made from cadaver fat. It's safe. It's ridiculously, it goes through a lot of safety stuff, but it's expensive. So that's for the woman that can afford it, that doesn't have fat to move around on her body, but really likes the idea of a saline implant, and either at the same time we know she's going to get ripples, so we do it, or in case she gets ripples, she can get Alloclay injected. And that procedure doesn't even need the operating room. It needs a clean room, but it's not really an operation. It doesn't need anesthesia. So saline implants. In terms of the rupture rate, it's kind of like very similar. So I think the traditional saline implant has a rupture rate of maybe 15% at 10 years, but I have news for you. The traditional silicone gel implant, which means every implant on the market in the United States for a lot of years, as far as I can tell, has a rupture rate at 10 years of 10 to 20%, which kind of sucks, but it's kind of true. So while I used to tell people, well, if you get saline, you have a higher rupture rate, I'm not sure it's true. The difference is, with a saline implant, if you get a rupture, you know it. It's like a flat tire because your body absorbs the water, so you go flat. With the Serene implant, because it has two chambers, you only go partly flat because only one chamber ruptures, let's say. The problem with the Serene implant, to get to the point, is that I don't believe them anymore in terms of rupture rate. I've seen way too many ruptures even at 2 or 3 years, so I don't primarily recommend that implant to anybody anymore, because I feel like I've been, to be honest with you, maybe sold a bill of goods in terms of, I'm not sure how, I believe there's probably been a problem with manufacturing that has developed and has really impacted rupture rates. It's a sad truth that, adhering to my principles of honesty, I have to share with you. So, why do you want saline maybe? Two reasons. You're really committed to the idea of an underarm scar. That's a good reason. So you're going to go saline. So even if it ruptures, we can replace it. And the other is the peace of mind. So the bottom line is this. I'd say there's no good scientific evidence today that really gives solid support to the concept that silicone gel is dangerous to your health. Okay, I just made a big statement. And that was true when the FDA re-allowed silicone gel for cosmetic use back in the market quite a few years ago, 2019 or 2009, I think, actually, maybe 2008. A long time ago. Yeah, it wasn't 19, it was 8 or 9, 2008 or 2009. So again, there is no evidence, no really good evidence at all of a cause and effect relationship between silicone gel inside or outside your breast and any diseases. But that's not really the end. Why isn't that the end? Because I'm talking to you at the end of November in 2025, and I might say something radically different because we might know more in March 2026. Because remember how people are going crazy over COVID and things changing? Well, guess what, people? Science is always evolving. And if you want to live in the world of science, then you are open to the fact that you're going to learn new things as we learn more. So that's where peace of mind comes in. If I had a 20-year-old daughter who wanted breast augmentation, I would recommend Saline, because I would say to her this. I would say, look, I've been around a long time. Did you know, my daughter, that there is a form of breast implant texture that is actually associated with a lymphoma that can happen in the breast? Well, there is. And those implants have been off the market for quite a few years. And if you told me that 5 years before it became knowledge, I'd look at you like you were RFK crazy, right? Conspiracy theories. So who'd have thunk? So what are we going to find out next? What are we going to, is there an adjuvant? We're exposed to a lot more garbage, a lot more allergens, a lot more problematic things that irritate us. And will silicone maybe down the road be found to partner in something negative? I don't know. So would I rather live my own life as David Rapaport without wads of silicone gel in my body? Yeah, I would. And would I rather have my daughter, if she wants bigger, lusher breasts, have them with something like salt water filling rather than a filling that has some degree of unknown? I would. So I'll let you think about that, and I think you should. And I think this is an example of misogyny even influencing female plastic surgeons, because there's a little bit of bullshit here. There's a little bit of arrogance of us thinking that what we know today is going to be the same thing in 10 years. And I'm old enough to know that almost nothing we know today is the same in 10 years. Okay, a little more tea. And then we talk about the new texturing, which even though it's called smooth, it is a different kind of surface that's in this new implant, which I'm quite excited about, but isn't so simple, the Motiva implant. We'll be right back.